Well, hi, everyone. I'm John Schmidt, Senior Vice President of the Value-Based Care Exhibit Hall. And we want to welcome to this week's Value-Based Care Exhibit Hall Flash interview. So thank you for joining us. Today, our guest is Mansukhani, and he's the Director of Partnerships with the Health Data Analytics Institute. And HDAI, by the way, is an exciting new exhibitor client of the Value-Based Care Exhibit Hall. And the company offers a predictive analytics platform that helps provider organizations like ACOs to identify and manage the care of high-risk patients. So very much needed. Kay is going to tell us more about that shortly. So that said, welcome, Kay.
Thank you, John.
I just had two questions for you today that I think will be of great interest to our listeners. First question is, so why do value-based care organizations like ACOs need the services of HDAI, or what does HDAI provide those organizations that can help them?
Yeah, great question, John. So value-based care organizations have been around for going on 10 years now. And what we've seen across the industry is CMS is pushing more and more healthcare into value-based care because there is a sense of overutilization of care. And we also spend 18% of our GDP on healthcare, which is much more than many of the other OECD countries. So it's important for us as an industry to make sure that we're spending the right amount for the right patients. And so far in value-based care, there's been players that have helped optimize different networks and helped figure out how to bring care to patients, but most of them have been retrospective. So the state of the union presently is looking backwards to improve decision-making forwards. And HDAI specializes in predictive analytics in a way where we are predicting in the next 12 months, 18 months, what outcomes are going to affect your patient population based on the history that they've had in the last 7 to 10 years. The way we do this is because we have privileged access to a CMS database that provides us 100 million patients over 20 years of longitudinal claims. And we build these models based on that huge database. And then we apply those models to a given population, to a prospective year. And so that, I think, is the biggest differentiator and something that value-based care needs to get ahead of the people who need the care at the right place at the right time.
Yeah, no, you're right on target, definitely. Let me ask you one other question. What does HDAI do that is different, you'd say, from other companies that might be offering similar analytic platforms?
Yeah, great question. So, John, our view of the world is that a single risk score isn't really truly giving population health folks a picture of how their patient is performing. And telling you that a patient is at high risk means different things to different patients. A patient at high risk for a COPD exacerbation might require a different intervention than a patient that's at high risk for developing dementia. And so we take that single risk and break it out into 50 plus discrete risks so that a care manager or a population health director or a chief strategy officer can know, this patient, like what are the risks that they are at high risk of, and therefore plan for the appropriate intervention. And we also don't believe in producing black box algorithms. We surface the specific coefficients in terms of what specific aspects of that patient's history has driven our model to believe that there is an elevated risk. So it is machine learning at its finest. And of our team, over half of our team are data scientists and trained epidemiologists. So it's something that we focus really heavily on. So I think that's one key differentiator. And like I mentioned previously, the concept of predictive analytics exists in the industry. It is a statistical concept that has been used effectively for a retrospective population, but no one is truly looking forwards and putting their proverbial money where their mouth is to say, these are the risks that these patients are going to incur in the next year. And getting ahead of that, if you can intervene upon those patients appropriately, you're talking about not only improving outcomes, but potentially saving millions of dollars, as opposed to when you look retrospectively, A, the outcome has already occurred, so there's not much you can do for that patient. And B, you're looking at, figuring out optimizing HCC scores or RAF scores, which I think are important to appropriately, delineate the severity of illness of your population, but doesn't do much in terms of intervention. So I think, those are the two critical pieces where we feel we're different, and why the community, is engaging with us.
You're right on target as far as the triple aim is concerned, right? Lower cost, better outcomes, higher quality. And it sounds like that's exactly what HDAI is all about. So that's very impressive. Thank you. So for more information, please feel free to visit the new HDAI booth at the Value-Based Care Exhibit Hall. That's it in front of you. And I just want to say thanks to everyone for joining us, and a special thanks to you, Kay, for giving us some insights into HDAI today. So please stay safe and well, everyone, and look forward to seeing you on another Flash interview. Bye now.
John.